Well, it may not feel like it because of how warm it is outside, but we are still in respiratory illness season. Our Jalen Banks joins us now with what experts say we should look for to stay healthy.
Outside of a few cold weeks, it's safe to say it's been an unseasonably warm winter, and despite that, the battle against respiratory illnesses continues. According to Public Health Madison and Dane County, the trend for respiratory illnesses are stable, but the levels remain high. This includes all respiratory illnesses. Of the main illnesses, the flu remains at a high level, while COVID and RSV are at low to moderate levels. But not all of these illnesses follow the same peak patterns.
COVID particularly doesn't necessarily follow some of these seasonal patterns that we see with some of these other respiratory illnesses. So it's not unusual for us to see a spike in COVID in the summer months, and that we've kind of seen that happening over the last couple of years.
And during this time, some urgent care facilities continue to see high numbers of patients coming in for these illnesses.
It's pretty amazing right now. There is so many respiratory viruses. In fact, that's probably more than 70% of what we're seeing in urgent care. So there's a lot of viruses around.
And Dr. Harkin attributes part of the increase to people being proactive in their care.
And now we actually, in some cases, do have some treatments for them. Obviously, for COVID, there's medications now to help shorten the symptoms, and the same obviously for flu as well. And so people just want to know what's wrong and what's happening.
As always, to stay safe, wash your hands, wear a mask, and keep your distance if need be.